Welcome to Smith Medical Coding Academy. This is our third video in the series, What is Medical Coding? We're currently exploring the medical coding code sets. In our first video, we explained what medical coding was. In our second video, we talked in detail about diagnosis coding. In this video, we're going to talk about CPT coding, or current procedural terminology coding. So as a reminder, the four code sets are diagnosis coding, CPT coding, HCPCS coding, and ICD-10 PCS coding. If you missed our series, there'll be links below for the very first video that talks about diagnosis coding. We're going to dive a little deeper into current procedural terminology coding, or CPT coding, today. So before you embark on an adventure of learning medical coding, some of the things that you need to know as a medical coder are here, beginning with medical terminology, anatomy and physiology, pathophysiology, pharmacology. We'll start there and then eventually get into beginning medical coding, intermediate medical coding, advanced medical coding, and then you'll need to allow yourself an opportunity to study before you take a final nationally recognized medical coding exam. Smith Medical Coding Academy offers a boot camp that can help you in that endeavor. The links will be below. So be sure to catch our first video that talks about the diagnosis coding code set. So we're going to continue on with our example of Miss Jameson, who has abdominal pain. And if you remember, diagnosis codes are what the physician's final assessment says the patient has. The procedure codes, or CPT codes, are what the physician or healthcare provider is doing. In this instance, this patient has lower left abdominal pain. And to evaluate that, the physician's going to perform an examination and perform an ultrasound, an abdominal ultrasound, a complete abdominal ultrasound, and he's also going to do blood work because he's not sure of what is causing her abdominal pain. He's going to ask her to follow up in 2 weeks. So each medical code set has a set of guidelines. In our diagnosis coding book, they are called OGCR, or Official Guidelines for Coding and Reporting. And there's a specific area in our diagnosis coding book, the very beginning, where our guidelines sit. In the book that we're going to review today, our CPT code book, the guidelines are spread all throughout your CPT coding manual. So the instructions in our CPT coding manual tells us to go to the index of our manual, and we're going to do that. And remember, Miss Jameson is having an ultrasound, so we're going to go to the index and look up ultrasound. And listed under ultrasound, you see the term abdomen, and CPT codes provides a range of codes that you should be looking at, all of them in that code range. The hyphen tells us that it's a code range that we have to look through. So we have to start from what our index is telling us and then maneuver ourselves to the tabular portion of our CPT coding manual. Using our proper procedures, we're going to take the code range that we found in the index and maneuver our way to the tabular portion of our CPT code book, and we're going to land on the code 76700. And as you can see here in the description, it tells you it's a complete abdominal ultrasound with real-time images. Right? You can read the description below, and this is exactly what we're looking for. So in this instance, we chose our code from the index. We landed on 76700. That information now goes on to our CMS 1500 claim form along with the actual diagnosis. That gets transmitted to the insurance company in the hopes that it returns to us as reimbursement. And when I say us, I mean the provider or healthcare provider. So just to recap, our each medical code set has a set of rules or procedures that tell us what we need to do to land on the exact code. And some of those procedures come by way of guidelines, coding conventions, symbols, and the example we use in the index was the dash and the CPT coding manual that tells us that we have a range of codes that we have to look at to make sure that we land on the one that has an exact match to the medical documentation. We also have indentions, descriptions, and bold terms that tell us exactly what we need to start out looking for in our index. So just to give you an example of what the guidelines look like, what if our physician documented that during Ms. Jameson's scan, he did not scan the kidneys or the spleen? So that means that we would need to know what encompasses a complete abdominal ultrasound. And the way that we know that is to go to the guidelines surrounding ultrasound. So again, in CPT, the guidelines are not located at the beginning of the book like they are in the diagnosis code book or the ICD-10-CM book. The guidelines in CPT are spread throughout the whole book. So we're in the ultrasound section of our tabular in the CPT, and you can see here, well, it tells you what encompasses a complete abdominal ultrasound. So you can imagine what would happen if we reported to the insurance company that the physician did a complete abdominal ultrasound and they asked for medical records. So our goal in medical coding is accurate translation from the medical documentation into a code set. So we've determined that our physician did do a complete abdominal scan, but somehow he has to let us know that two organs, the spleen and the kidney, were not under his review during the scan. So if we go to our page of guidelines surrounding our ultrasound, you can see the organs are listed here. You have all the organs listed here, including the spleen and kidneys. So for some reason, he didn't feel that it was medically necessary to also view the spleen and kidneys, especially if he examined her, touched her, and had a general idea of where the pain was coming from. He had every right not to scan the spleen and the kidneys if it wasn't necessary. So now, having said all that, he can't then go to the insurance company and report an accurate diagnosis and the diagnosis 76700 as a complete abdominal scan and expect to get reimbursed for all of the money when he only did a partial scan, right? And there's no CPT code in our code book that tells us that there was a partial scan. So how do we solve that? The next slide will show you. So in order for us to accurately report what the physician did during his time with Miss Jameson, we would need to add what we call a modifier. And modifiers modify the CPT codes, given a more clear picture of what was done in the entirety of Miss Jameson's evaluation. So we have our diagnosis code here, a lower left abdominal pain, plus a complete abdominal scan, and we're adding a 52 modifier that tells the insurance company that reduced services were provided. So that means that we're not, upcoding, or we're not committing fraud by saying that we did a complete ultrasound and expecting to get all the money when our ultrasound report will show that both the spleen and the kidneys were not scanned. So they in turn would reduce our money by what they think is fair for just doing all of the organs minus the spleen and kidney. Thank you. That concludes this video presentation on CPT coding. If you like this video, don't forget to like, comment, share, subscribe. I hope you learned something today. Remember, there'll be links in the description below for Smith Medical Coding Academy. We do offer boot camps available if you're in the process of trying to find some help in studying for a nationally recognized certification exam. Again, thanks for watching.